They are the questions we are all asking ourselves. The questions only the UK governments can decide, with answers that have a huge impact on all our lives. Doubtless these are things that ministers wonder about as well, but they must also make judgments on behalf of all of us. The first, what needs to happen for restrictions to ease? For a start, the health service needs to be coping well. In January, England's NHS cared for 100,000 COVID patients. That's 1/3 of the total for the whole pandemic. And today, its boss made it clear ministers can't expect a quick recovery from that.
We are, fortunately, beginning to see reductions in the number of severely ill coronavirus patients in hospital, down by about 1/3 over the last fortnight. But remember that even today, we've still got more coronavirus patients in hospital across England than we had in the April peak of the first wave of coronavirus last year.
Since then, we've seen a new variant of the virus sweep across the UK, with surge testing now monitoring whether any other mutated strains have gained a foothold. And even though the vaccination programme is well on track, the unpredictability of vaccine supply could still derail the timetable. Both of those are warnings to consider what could go wrong, what could throw government plans to ease lockdown off course. With no way of guessing what's around the corner, experts say unlocking slowly, bit by bit, is the only option.
So, for example, if some children go back to school, you need to give it, as is the case in Scotland, around 3 weeks or so before you make a different change, because you have to assess how well that's gone. We've learned that from earlier in the pandemic, and that's what I hope governments will do this time.
So when will things feel better? The signals from government are to expect small steps through the spring, and doctors say that's probably for the best.
That change from going from the insecurity that we've lived with, the precautions that we've taken, to suddenly being out there entirely is very disconcerting. And we know that a stepwise approach actually, for many people, will help more.
The last time a shrinking epidemic brought the R number below 1, over the summer, the government swiftly opened up many aspects of our lives. Although this spring will also see an end to lockdown, there will not be such a rush this time. Catherine Jones, 5 News.